Please note this video is for educational and informational purposes. It should not be used for diagnosis or treatment of any disease or substitute. Doctor office visit. Hello, today we are going to talk about diabetes. What is diabetes? It is a condition when glucose metabolism is disturbed as a consequence. Sugar remains in the bloodstream longer, where it damages certain organs such as eyes, kidneys, heart, and blood vessels. How glucose is metabolized once food is. How glucose is metabolized? Consumed glucose is absorbed into bloodstream and blood sugar level rises. Then pancreas senses blood glucose spike and releases pre-made insulin to distribute available sugar to organs. Based on their need, insulin is a hormone that is responsible to transport sugar into tissues. First, insulin carries glucose and delivers the tissues where it's in high demand. Excess sugar is deposited in the form of fat underneath the skin that is called subcutaneous fat, and around the intestines that is called visceral fat. This is how blood sugar is metabolized while reducing circulating levels. Therefore, eating excessively causes subcutaneous and visceral fat deposition, leading weight gain. Let's talk about types of diabetes. There are types of diabetes. Two types of diabetes, type 1 and type 2. Type 1 diabetes seen less than type 2. Diabetes in ratio former to latter is around 15 to 85% type 1 diabetes, caused by either lack of or very little insulin production. This group of patients usually diagnosed before age of 30 and require lifelong insulin administration. Type 1 diabetes, as we said above, accounts around 15 of all diabetes, and today we discuss mainly about type 2 diabetes. What is type 2? Diabetes type 2, diabetes is more common type, and it is caused due to increased insulin resistance, meaning but it requires more insulin to distribute blood sugar. This type is usually diagnosed in people in their middle age. Initially, type 2 diabetes have enough or even high insulin production but cannot metabolize glucose due to insulin receptor resistance in initial stage. Pancreas can compensate receptor resistance by producing more insulin if insulin resistance is not corrected. Then, in later stages, insulin production reduces due to pancreas burnout, and patients require exogenous insulin administration. Again, insulin produced by pancreas in response to blood sugar and is responsible to distribute sugar to organs, tissues, and remaining sugar is deposited underneath the skin and around the intestines. What organs affected with sustained elevated blood sugar levels? Retina, that is the inner layer of the eyes, large and small vessels, nerve, kidney. Heart injury with atherosclerosis, leading to coronary artery disease. Eyes and kidneys have many small vessels, therefore their injury is more common than other organs. Statistically, people with diabetes have a high risk of having coronary artery disease than general populations. Therefore, blood sugar level control is very important. How insulin resistance happens. Resistance happens. First factor contributing to insulin resistance is excess body weight, specifically body fat percent, because fat tissue requires more insulin than other tissues. There are 3 types of tissues in human body. First, bone, second, muscle, and third is fat. Bone is not as metabolically active and does not require much insulin. Muscle is metabolically active and has higher sensitivity to insulin. Fat tissue has a least sensitivity to insulin, requiring more insulin to uptake glucose. Thus, fat tissue is the main contributor of insulin resistance in diabetes. Therefore, decreasing body fat and increasing muscle mass significantly improves insulin sensitivity and prevents diabetes. Type 2 diabetes starts with metabolic imbalance of glucose while pancreas is producing normal to high insulin, causing receptor downregulation, making insulin unable to metabolize glucose. Sustained blood sugar levels causes diabetes symptoms untreated. Condition may lead to symptoms and complications, such excessive thirst, frequent urination, extremity numbness, due to nerve damage called neuropathy.